Thank you, Mr. President. Thank you for the presentation. I know that we've been corresponding, my office and myself, with you over the last number of weeks waiting for today's briefing because my inbox, my cell phone, my DMs have been flooded with residents who are very concerned about monkeypox. Mm-hmm. And we see what is happening in other jurisdictions, and they are concerned that we are not adequately equipped to provide vaccines to make sure that everybody is healthy and safe. Can you give an update as to the state's role in this and just remind people that we are not like Washington, D.C. We are not a city-state with direct access and direct control, and that we do rely on the state and Governor Hogan to provide us. So can you share what that relationship is right now?
Mm-hmm. I'll start. Sure. So thank you, Council Vice President Glass, for that question. So the state, unlike the District of Columbia, we don't receive our vaccines directly. We have been working with the state. The state manages the contact, investigation, case tracing, et cetera, and provides us with the information. But more importantly, once the vaccine is received from the CDC's Strategic National Stockpile, it's distributed and allocated throughout the state. The three largest counties, Baltimore City, Prince George's, and Montgomery County, received the first tranche of the vaccines. We requested more. We did an analysis with our HIV/STI clinic to identify those individuals who were at greatest risk. We notified the state, we presented it to them. We've been supporting the state's contact tracing effort. We also know that some of the cases, as far as our post-exposure prophylaxis that we have administered, have been interjurisdictional. They've come from other places. And so we prepare for that. We've met with our clinicians, our doctors. We've participated in calls with the CDC and the state so that our team could be well informed. And so going back to your original question, we don't get the doses directly. The doses that we have is based on demand, and we have set up a system, a strategy in place where that we can identify those individuals who are at greatest risk, provide pre-exposure prophylaxis, and then post-exposure prophylaxis. So we've built the system, but again, we don't control the doses. We've requested more doses. We've requested capability to store more doses, and we've also talked about expanding to our Germantown Health Center because we know that we are building an HIV/STI clinic there, and we want to have the greatest access for everyone. And Kimberly, you can add to that.
The only thing I would add is just reinforce that we have requested more doses. The doses that we have received, we are providing vaccination and we're providing screening to our community members. And we hope that we'll be in receipt of additional vaccine over the next week or so.
It appears to me this is deja vu all over again, which is another reminder to all of us in government at all levels that we need to be prepared for health emergencies, future pandemics, try to stem them so that situations don't become pandemic-like, despite the WHO declaring monkeypox a global health emergency. And I appreciate the framing today about who this affects, and it affects all of us. And some of that framing has not been accurate over the last week or 2 weeks. Not only, I'll say, here in the county in some public conversations, but across the country, we need to make sure that these vaccines get to everybody because it affects everybody, not just one segment of our community. Dr. Bridges, I don't know if you were...
Yes, Council Vice President Glass. One point that I omitted and it jogged my memory when you referenced deja vu. So anticipating of the increase and providing those community level protective measures, we increased our staffing as well. We knew that we needed more clinical staff. We requested from the department to get not only a nurse practitioner, but another nurse. We know we need to treat folks, we need to isolate folks, and we need to make the county safe. So I just wanted to add that.
Absolutely. Well, come to us and let us know what we need to do to help with staffing and help with whatever other preventative measures and administrative procedures as well. One last thing I will say, there have been some residents who have expressed concern over what they consider a catch-22 in our policy, being that an individual can only receive a vaccine if they put themselves at greater risk. And that does not seem to be the the best health policy. Can you explain that a little bit more?
We've had some calls on our helpline regarding individuals who wanted, and I know as of this morning, the District of Columbia moved to a single-dose treatment regimen. We're still monitoring our community level transmission rates and are still guided by a 2-dose treatment. We've had calls principally to share with us candid conversations about folks putting themselves at risk. Absolutely not. We will treat you, we will assess you, we will contact our clinicians and provide the best information. There is no need to put oneself in harm's way to get vaccinated. We are assessing it. We've identified folks. Our case managers, our clinicians have worked with our community partners. We've done extensive outreach over the past 6 weeks to identify those individuals who are at greater risk. And that's our primary focus. We want to safeguard those individuals who are at greater risk and then expand it in a public health ring practice, if you will, similar to what we did with COVID, as you referenced before. We started with those individuals who were at greatest risk, our seniors. And then we looked at those individuals who had chronic illnesses. And then we looked at those individuals who were unvaccinated. We've taken a similar public health strategy to identify those individuals who are at greatest risk. Please, if you have any questions or concern, please, for all our countyans, our great countyans, please contact our helpline. We have individuals there who've been informed and prepped. It's a bilingual helpline. And if you have some concerns, please send us a note because we are addressing all concerns. I hope that answered your question. Kimberly, if you'd like to add anything to that.
Last question I have, in correspondence with the state, do we know when we will expect more doses?
So we were advised the next few weeks we should receive more doses. The 3 jurisdictions that currently have doses. We don't know for sure. We don't have an exact date, and so we're still waiting.
So I've requested an additional 600 doses in addition to the tranche that we have based on the capacity. The state has received that request, and Kimberly and her team are waiting for a response.
And so request of 600 doses in addition to the 200 we've already received?
Yes, that's correct.
Okay. For a jurisdiction of 1.1 million, let's get the state to act as quickly as possible. People want this. We want to stem the spread of this problem, and it is, we're going to do everything. And so keep talking with us to let us know what we need to do aside from continuing to contact the state and letting our residents know that we're doing everything that we can within the powers that we have here. So thank you for the update.